If you're currently dealing with SI joint pain, you are not alone. Maybe you've tried injections, massage, stretching, chiropractic adjustments, and literally nothing is working. Well, in this video, I'm going to show you 4 things that people do a lot to release SI joint pain and tell you why this actually be making the problem worse. Instead, I'm going to give you some smart, simple solutions that promote joint longevity and muscle health. Welcome to the Joint Longevity Lab by Fitness Integrated Science. My name is Lauren Irk. I'm a muscle activation technique specialist as well as a certified yoga therapist. And I can't tell you how many times my clients have come to tell me that they have SI joint pain, they have tightness, they have a hard time walking, and it's taking away from the quality of their life. In this video, I'm going to go over 4 exercises that people could do that will help this problem get a lot better. Now, before we start looking at some of the major problems that I see, I want to first go over the SI joint itself. A lot of people, from my perspective, don't know where the SI joint is and what it does, and when they hear things from their doctor, they just have a lot of fear around it. So if you would, take the web space from your index finger and thumb and place it on the top of the pelvis. Now, what you notice, this area of the body anatomically is your iliac crest. The front of the iliac crest, you can see where my index fingers are pointing down, there's a large chunky area of bone. That's the anterior superior iliac spine. That's where a lot of your hip flexor muscles attach. And then we have this area in the back, the PSIS, the posterior superior iliac spine. This is where your gluteal muscles actually come around and attach, and also some of the deep rotators of your hips, such as the piriformis. At the bottom of the pelvis, we have our sitting bones. This is a large chunk of bone called the ischial tuberosity. This is where the hamstrings, a lot of the inner thigh muscles kick in. The inner thigh muscles attaching all down that pelvic floor, and the front of the pelvis, where these 2 pelvic bones come together, we have the pubic bone, where the abdominal muscles come down and attach. And a lot of times what happens when women have become pregnant and muscles start to become more stretched, the ligaments become more lax, we can certainly see some instability across this region, and that will absolutely cause SI joint pain. But here's the thing. The SI joint itself is really not designed to move very much, if at all. If you take your 2 hands and smash them together and then try to move them, that's about as much as your SI joint is designed to move. It's very similar to an architectural structure called a keystone. We have a sacrum in the back of our pelvis that is a triangular flat shape of bone that's a bunch of fused vertebra that when the pelvic bones come around and make their attachment into it, we have a forced closure. So many times what we're feeling with SI joint pain is a muscular dysfunction problem. If all the muscles that attach into one side are not as strong, or some of the muscles, as the other side, we could have an inadequate pulling system, and this could cause instability, which is what we don't want. So let's take a look at some of the 4 popular things that people do to release SI joint pain and try to look at some alternatives. Now, just before we get started, if you're experiencing incontinence, if you're experiencing debilitating pain and numbness all the way down into your foot, you might want to go see a doctor and have an MRI. You might have a serious issue like a herniated disc. Otherwise, one thing that I see immediately, and you're going to nod your head, people love getting massages. They love rolling around in the cross balls, taking their hand and just rubbing it in there, or getting that Thai massage, or they're walking along. And this may provide temporary relief, and people will use this long term to manage this condition. However, it's not going to fix the problem. So let's say that I was feeling tightness in the outside of my hip, and it was causing me not to be able to maybe do this. You see a lot of people sitting in chairs when they're trying to externally rotate their hip, and they're trying to push down, or they're massaging the outside of the hip. What if the reason that I can't move my leg out to the side or externally rotate my hip is because muscles are actually weak? One of the biggest areas that causes SI joint pain is weakness in the outer hips. Now, we need these muscles when we're walking. We pick up one leg, those muscles have to kick in, or we fall. So how do we get this stronger? One thing we want to do is get really good at standing on one leg. And this is going to be an alternative to massage that is only temporary and could be making the muscles weaker. So I'm going to take a support like this and just start to shift my body weight into one of my legs. I'm going to use the leg that's obviously closer to the bar. When I'm doing this, I'm going to take the outer hip, this greater trochanter, and start to move it away from the bar. That's going to immediately draw tension to the outer hip. From here, I'm just going to bring my leg up off the floor, and now I am focused on balancing all of my weight over my foot. This hip is also dealing with the weight of this leg, which is pulling it to the ground. So standing on one leg is a great alternative to massaging the outer hip. By making these muscles stronger, it's actually going to reduce the body's need to tighten things up because it's sensing more stability. Now, as a progression to this exercise, one thing that I really like to do, and this can be done with a pillow or any kind of object that you have lying around the house, although I love these sponge balls. I'll put a link for one of these below in case you want to pick up one of these. But at any rate, when you push it between the legs, we now get immediate feedback, not only from the outer hip, but from the inner hip. So the more muscular support that we can give that lumbopelvic girdle, the better we're going to feel. So let's go back into our thing. As we squeeze into the ball lightly, let's pick up that leg. This is going to feel very different. Now I've got muscles on the inside of my hip and the outside of my hip. And I can actually move in and out of position, which is what happens when we walk to a lesser extent. So what I want you to do to start is just allow yourself to sink in and come out of that position. And obviously the ball is keeping my legs together. You can see that my hip is really sinking out to the side. Now, when I start to return back into that standing position, I can not only work the outer hip, but the inner hip at the same time. So I'm going to squeeze the ball lightly, and just like I did before, I'm going to engage the outer hip until I eventually go all the way to that upright position. Once I'm here, and I'm very lightly squeezing into the ball, I'm getting a lot of work on the inside, the outside of the hip. I could even practice just very lightly moving my leg away from that ball just a little bit, so that now this hip has to pick up even more. So as I come back out of it again, I'm sinking into the position, just allowing that leg to drop. And then as I come into it, I'm going to lightly squeeze into the inside of the leg as well as the outside of the leg, bringing my pelvis to a level position and then very lightly moving it away. So thinking about strengthening that arch on a building, making those forces that are moving from both the right leg as well as my left leg, and really strengthening on both sides of my body to reinforce that SI joint from a muscular standpoint. And this is also great to do if you've recently delivered a baby, right? Working on the outer hip. Now, for my second thing that people do all the time, and this is something that I've seen for years as a yoga instructor, people stretch. People are always trying to go into these deep stretches. So you see people trying to bend forward and stretch their hamstrings, or maybe they will reach for an object and try to lay their body over it. Or maybe you see people on their back and they've noticed that they have all this pain going down the back of the leg, and now when they're trying to pull that up, and they'll grab their leg and pull, or they'll grab like some kind of a belt or a strap and try to pull that leg down, even trying to pull the foot through, thinking that if I can just release these muscles, I would have less pain. Well, what if the reason that we are feeling pain in the outside of the leg, again, the opposite side is weak, which very much can be the case in an SI joint problem. So instead of thinking of stretching the hamstring, how do I strengthen the front of the leg? So let's say that I'm noticing that this leg moves this far, but this leg, I can only move this far. Well, this is telling me that I am pretty weak down here. And if you think about gravity's influence, my leg is going to feel very heavy here on the ground. So although I give this exercise to clients where I have them lie down on their back and just try to hold their leg up, many times when someone's in a lot of pain caused from SI joint dysfunction, this can actually be far worse than the problem itself. So instead, what I like to do this from a standing position, especially initially when someone is having problems. So when we're standing, you can see that gravity is running through me. Raising my leg, I would have to get to 90 degrees before I maxed everything out, instead of starting off maxed out on the ground. So the first thing that I would do is I would start by giving some slack to the muscles that cross the knee and focusing more on muscles that cross the hip. So bending the knee, I'm just going to start with a shorter lever so that muscles, we have the two-jointed muscle like the rectus femoris, let's just say, that attaches from the hip and the knee. the knee attachment is under slack, and I can focus on just creating tension across the thigh. Now you may notice when you're having a really big SI joint flare, you can only lift your leg this much. And I always tell my clients, that's okay, right? Do that today. Work out in a way that you can work out again tomorrow, right? So I'm just lifting that leg up enough, no shaking, no cramping. It actually feels pretty good, pretty therapeutic, and I'm still getting that standing leg stuff over here, right? So I'm getting a lot of really nice work across that SI joint. Over time, you may be able to start adding a lever length change by extending the knee, which accomplishes two things. I'm picking up more load without having to add weights or anything. I'm just using my body weight. But I'm also dealing with the other attachment. So going back to that rectus femoris, it's going to attach on the ASIS, that chunk of bone here, and the superior aspect of that patella. So by moving with a straight leg, I'm actually going to be strengthening that over time. One other thing that I really like about doing this from a standing position, I don't have to do straight on. The resistance is going straight down. I could actually move from an externally rotated position and start from here, working on hip flexion there, over time, just holding that for a few seconds and then coming back down. And just like I did before, I might want to, over time, start moving into lever length changes. And yes, if I feel that hamstring kicking in, instead of thinking, oh my gosh, I need to stretch my hamstring, I want to think to myself, wow, my hamstring is kicking in because my nervous system is saying I don't have strength here. So getting to this point is something to work on over time. And this is actually a pose in yoga, right? It's that Utthita Hasta Padangusthasana, where a lot of people will grab their strap and hold it. Why not try it from an active standpoint and then moving that leg out to the side on your own? This is a great way to release hamstring tightness without having to go into those deep stretches, which might actuality be causing the muscles to go weaker. So the next thing that people do is they like to go and get adjustments, and they're told that your SI joint is out of alignment. Again, I'm just going to say it. Your SI joint is really not designed to go out of alignment. It is pretty tight, pretty intact, unless you've had a really big fall. However, you could 100% be feeling problems within that system because of muscular imbalances. So what I'm going to do is I'm going to come on down to the floor and I'm going to show you a better way. So we know that we have to really work on muscles that really wrap around the body. So I'm going to show you another exercise. Instead of going in and being told that you have to pull these together or reach across or something like that and trying to get that pop in your SI joint, that adjustment, what if the problem is that you just need to work on stability across that region? I like to do things where my core is having to stabilize while I'm working hip muscles. So let's take that ball, place it in between the knees. So now we're back into that adduction position. However, I'm also going to be incorporating muscles in my core. So as we lower down onto the back, let's begin by lightly pressing into the ball. That immediately brings in my inner thigh muscles, and then if I want to, I can voluntarily engage muscles in that pelvic floor region. Then from there, as we exhale, right, as we exhale breath, we start to flatten that lower back. That brings in the abdominal muscles. It also brings in our gluteal muscles a little bit while we're working our adductor muscles. Then on the inhalation breath, I release the ball a little bit, my pelvic floor starts to relax, and we notice that lower back coming off the floor. Look at all that we have accomplished to strengthen that whole pelvic floor region. So again, as we squeeze into the ball and tighten, we flatten out that lumbar curve, we start to engage the pelvic floor and tighten into the glutes a little bit, and then from there I might even want to go up into a bridging position. So now I am truly getting my spinal erectors, which are working to stabilize my pelvic floor. Then as I lower down, I'm coming back out of the position and releasing it. So again, as I squeeze into the ball, exhale, flatten out that lower back, pelvic floor engages, I peel my sacrum, my back off the floor, and here I am in my bridge position, really working on tightening into the gluteal muscles and holding. Now once you're here and you're feeling really good, I could even practice shifting my weight into one side more than the other. That's going to 100% bring in that gluteal region and also bias some of the spinal erectors on that opposite side, right? Trying to hold that up. and then eventually maybe even lifting 1 foot off the floor. That is a great adjustment. Now, I could do the exact same exercise with a different tool. That's why I love working with props. You can use any kind of banded distraction. I've even seen people just tie belts around their legs just from your closet. Just take your belt, make it into a notch, and make sure it's no wider than hip width and tie it around your legs. But I've got a little thigh band here. This brings in a different set of muscles, right? So now when I push out, now I'm working with muscles that sit on the outside of the hip that attach all down around that iliac crest and into the greater trochanter. And then from here, I am actually working on muscles that externally rotate the hip. So I could practice moving the legs outward and then bringing them right back into the center. Bringing them outward and then bringing that back into the center. Then from there, maybe going into my bridge position, and the gluteal muscles love moving outward. That's what they do the best, is externally rotate and come back in. So if I want to go into that same exercise that we did the last time, I would take a deep breath in and then exhale, lower that back down to the floor, coming off the belt. Inhale, breathing, flatten out that lower back. And then as we come up, we want to push out into the strap, squeezing into the outer hips. And as the inhale, we come right back down to the center. When we combine those two exercises, from pushing out to pushing in, while performing the bridge, working in that posterior chain, what's going to happen over time is we're creating more stability across our SI joint, and the body will have less of a reason to have to tighten up and cause pain. Now, for the last problem that I see that people make is that typically, and I think a lot of this has been driven by the physical therapy profession, insurance a lot of times will only cover the injured side. So if I have sciatica going down this leg, we immediately think this is the leg that has the problem. So we want to make sure that we do bilateral work. It very well may be that the side that is tight, that is painful, is doing all the work, and the other side is not. So let's try another exercise that I really like. I'm just going to flex into my bottom leg, so I don't have to worry about going forward or back. And then we just come down the side. So I'm feeling, let's say I'm feeling some pressure on the outer hip, and I go back into my internal rotation position. And I notice as I'm lifting up and going down that, yeah, I feel pretty good. And this is actually the side that's been hurting me, but I think to myself, but even though this is the side that's been hurting me, I have pretty good range of motion. And this is a great exercise to do, by the way, to work a lot of those abductor muscles. But then when I flip over to my good side, the side that's not hurting, then I go to that same position and I notice, oh my goodness, I can't internally rotate as far. What happened? Why would that be that this side is hurting, but this side isn't moving very well? And then when I go to raise the leg, I notice that my leg is shaking and cramping. It's not actually not as strong as the opposite side. What would that tell me? In actuality, always focusing my therapies, my stretching, my massages, all of that on the side that hurts, I am completely missing the whole problem, which is that I have a huge amount of muscle weakness on the opposite side. So from the idea that we, instead of massaging, instead of attempting to adjust, instead of doing those deep stretches, and instead of only focusing on the side that hurts, if we could switch everything over and focus on how do I find my weaknesses? How can I train my weaknesses? How can I make my limitations into an area of strength? From isometrics to calisthenics and to eventually adding load. Now, if you'd like more information about how to do this from point A to point B, being led through a series of exercises, head on over to Fitness Integrated Science TV, my platform, where I have lots of programs that I've developed that deal with SI joint problems. If you like this video and you learned something, I would love it if you would give me a thumbs up, make sure that you're subscribed, and also share it with anyone that you know that I can help. Thank you so much for watching, and I'll see you next time.